He always got like a 99 on the test. He just lost points for like, 5x plus 2 equals 7, and then he's like, 5, duh.
Like literally, these are not exaggerative things. I write like on the paper 2 times 1 is equal to 3. Like I can show you that on a test.
Globular ducts in a...
Globular ducts. Wait, what is this?
Sounds a bit ridiculous.
Like nice lactiferous ducts.
This stuff's hard. I think this is the hardest slide.
Well, it has a little milk in there. But I'm just trying to think. I would probably... See, what I don't like about this slide... Let's not do it. Huh?
I mean, if you don't like it that much.
Dr. Brain, I was actually curious about this though. The human mother makes milk, and it contains lactose according to like 7% lactose. Yeah. But if in the newborn, do they already have the bacteria making beta-galactosidase for them, or can they not?
That's why the first week it's colostrum.
Like they get it immediately?
Maybe. I'm not sure.
You have to.
Because I would assume you're born lactose intolerant.
Why? Why would you think so?
You may be born
have E. coli.
No bacteria in your small intestine.
E. coli?
Because I think it's E. coli makes beta-galactosidase for you, right?
No, it's like the other lactase. But there's like 5 other bacteria.
Yeah, so...
That may be why there is colostrum for the first week and you don't have
Fascinating.
I mean, this is probably a more characteristic view. Why? Because... What do you have here? There's at least, you have a lot of adipose tissue. Yeah. If I show you normal breast, resting breast, I will show you adipose tissue.
Nice.
What are those large things?
The characteristic specific lobular structures are these lactiferous ducts, even with a little milk in it.
That's milk right there?
Looks like a
breast fluid, it's not really milk. The stromal, I don't like the way the stroma is stained pretty much in this one. It's sort of,
Yeah, it looks a little...
What was that in the book where he said, like, you can stimulate women who have never, never been pregnant to produce milk?
Can they?
Yeah. I think he said they can.
They can, yeah. Men can produce milk, too. You just...
So wouldn't that prevent your risk for breast cancer?
Junior. Remember that movie?
Wouldn't that lower your risk for getting breast cancer if you can induce...
Yeah, presumably. I'm not sure if that's known. I published a letter in The Lancet a few years ago.
It's a good journal.
About when babies are born premature. Unfortunately, like for example, if a woman has breast cancer, they typically advise her to have an abortion, which is a bad idea. Because that increases her breast cancer risk. Or they'll say, we really want to blast you with chemotherapy and get rid of the tumor, so we're going to induce as soon as it's safe for the baby. So what do? They induce labor at 30 weeks. They say, the baby will be fine. But that's like having a late-term abortion, drastically increasing the woman's risk of breast cancer, rather than waiting for 32 weeks.
So that's right before the conversion, right?
Which is, when she actually gets a protective effect. There's a lot of...
Silly doctors.
Ignorance, yes. There are a lot of silly doctors out there. But I suggested in that letter that it would probably ultimately lower a woman's risk of breast cancer. Then she could be, once she has the baby, if the baby is like put right onto the breast and it suckles, even though the breasts are not mature yet, you can induce production of milk. Now, does this necessarily give you the same protection as waiting for full term? I don't know. Not enough data. Nobody studied it, but presumably, it would help. It certainly wouldn't hurt.
So if you get a baby to suckle on a woman that has never been
pregnant,
she will start lactating?
As I said, even men can be stimulated. I'm not sure just with suckling. You probably need some hormones.
It's an experiment.
But you can. It's different than the internal genitalia, let's say, of a woman which are destroyed by AMH in the male. But the breast is not. The breast of a 10-year-old boy and a 10-year-old girl are identical.
That's what I always say.
And then,
Wow.
Oh, wow.
Wow.
What did he say?
Wow. Let's keep going. Let's keep going. Let's keep going.
Is it Jerry Sandusky?
Wow. Oh. That was.
Talk about 10-year-old boys. It attracts a bad element.
Anyway, back to.
Well, anyway, recording. So this is.
It's going to be on YouTube tomorrow.
Tomorrow?
Sounds like a conversation at Penn State locker room.
Okay. So anyway, to recap, as far as the breast is concerned, for resting breast, I would show you the characteristic duct structure, and also I would make sure that there's some adipose tissue in there. because that's, the breast is a structure that normally has a fair amount. The only time you really can't see any adipose is in a lactating breast, because there's nothing but alveoli filled full milk, as you see in that one. So this would be more characteristic. As I said, the stromal tissue looks a little atypical instead of looking sort of fibrous. The staining here looks more like kind of broader strokes for the stroma, which is dense connective tissue. But you can see there are very few cells here. You got a few fibroblasts and mostly collagen there. You have your breast adipose tissue. So if you see stroma, you see adipose, and you see the typical duct structure. That's what I'm going to show you for a resting breast, because those are the things that are characteristic of the tissue.
Cool.
Now we have lactating, which can't miss the difference between resting and lactating, as you'll see. And
that's pretty clear.
Yeah, it's pretty clear.
All right, moving on.
It's, all that.
What's this now?
That's basically, it starts to look a little bit like, things like seminal vesicle,
It's more like an open.
You start seeing things like that, so I'm trying to think what is more characteristic.
Lack of cilia.
And the thing is really, I would show you a fair amount of this
substance.
Milk.
Wait, this is lactating breast?
Yeah.
This is lactating breast. And it sure looks different from resting breast, but it doesn't look all that different from seminal vesicle.
Cilia.
So the difference here is really going to be the abundance of dried milk that you can see in the
So see how seminal vesicle on the top?
That would be wrong.
It's fully wrong. It just
Yeah, it's wrong. You're gonna put all the wrong hormones.
no
Oh, you mean, do you get part credit for calling the breast seminal vesicle? Try that with your girlfriend someday. The seminal vesicles you have there.
Wow.
I probably wouldn't know what it is.
Wow.
I don't think so.
Call
you
you
really need to
calling
learn
Mike's
the
girlfriend
difference
dumb?
now. Pay attention. Okay. All right.
And it's worse than my question.
Okay, so now are we done here?
Yeah.
Yeah, all right. That's basically residual milk should